From the government facilities, 8 people have been charged, are being investigated. The issue that has been there is that our health facilities have been conniving with the private actors. First of all, to traffic patients outside. They go and they get fleeced there. Even when we have either medicine or equipment to work on them, like laboratories. Those laboratories, first of all, some of them have been using unqualified staff. Some of them have been using expired reagents, imagine.
The arrests follow an investigation and expose by NTV Panorama and the Daily Monitor into impropriety at the largest public health facility in the eastern part of the country. The investigation unearthed a cartel involving some doctors, nurses, clinicians, administrative support staff at the blood bank, guards and other attendants that work together with private clinics near the hospital.
Many of those clinics nearby, one, they're either for the work, the nurses themselves and doctors, or the doctors work as brokers. They work as brokers where they get a commission, which is very unfortunate. If you take a patient to Mbale Hospital, just be sure of him dying. That one is a sure deal. Be sure of him dying. Be sure of him, or you buying drugs. There's nothing that you get from there. But apparently, government sells drugs.
In one instance, the investigation found this young man who had broken his leg in a motor accident in Bulambuli district. When he came to Mbale Hospital, he was not attended to for 4 days, a tactic normally used by corrupt medical workers before patients are approached by seemingly good Samaritans who advise them to go for treatment at private clinics near the hospital.
So someone picked me then took me to Koma Hospital, that is Health for Life, is where I was worked from. So that they told me that doctors who works on bones, they are not around. So that maybe they take you to private hospital. So I went there.
When he visited a private clinic in Nkoma Ward, he was operated upon and clamps were placed in his leg at a cost of 1.5 million shillings. However, 3 months down the road, the clamps snapped and subsequent scans have shown that the operation was poorly conducted and he now needs corrective surgery, which will cost him 4.5 million shillings.
An example, a broken patient, when he enters the hospital, they tell him, there are no doctors here. Let us take you outside where there are doctors. These ones are fake doctors. So they bring them to us and then we work on them. Sometimes we do good work, at times the work is too hard for us. But of course, the
corruption and extortion at Mbale Hospital has been common knowledge among the leadership and opinion leaders in the city for some time now.
But I've always intervened it by linking up with the management of the Regional Referral Hospital to ensure the culprits are brought to book. However, the other weakness we have from the patients is that if they asked money, to them they go to look for money instead of informing us people who are charged with ensuring that we curtail that behavior.
However, minimal steps have been taken to solve the problem and provide relief to the beleaguered patients.
I want to tell you that we've been coerced to compel some owners of this facility to refund money to the patients so that they can go and access proper tests.
Of course, you mount an operation today, they wait for 1 week, there is no follow-up, they come back, but of course it's there, but we are also not sitting back.
Mbale Regional Referral Hospital, established 98 years ago and with 415 beds, serves more than 15 districts in the eastern region. The hospital has a shortage of equipment and specialized staff, although, according to the Ministry of Health, it is one of the most staffed facilities among the 16 regional referral hospitals in the country. Gillian Nantume, NTV Tonight.